Okay, I hope you prepare your notebook this time for Assistive Technologies Laboratory. This is our last lesson for the whole prelim. This is the only topic that we have left before your practical exam. Okay, so for your practical exam, we'll have 4 topics. Syempre ito, kinesiotaping. We also have bandaging, splinting, and side questions will include the 3 and including splinting as well. Okay, thank you so much for the 8 attendees that we have here tonight. Okay. Thank you guys. Last na lang gid ni promise. By Thursday, you can sleep in the morning. Okay? For your lecture though, have you met with Doc Kim for a synchronous time? Synchronous na time? With Dr. Hinko?
Not yet,
Not
bro.
good, sir.
Not yet. Okay, not yet. Actually, ang
Videos lang
plan
ata.
videos lang. Okay, for the videos, it was about orthotics, correct? Nakatag siya about amputation. Any idea? Sige, i-search ko na lang. Kaya if wala, I'm planning to have the lecture na lang yun eh. I-lecture ko na lang kamo sa amputation para at least may unod man siya. Alright, sige, it's 6:34. We'll try to finish everything in under 40 minutes. Okay, 40 minutes lang ah. Let's do this as fast as we can. Thank you very much for everyone who is here right now with us sa Teams. Char, kasi vlog lang eh. Okay, sige, let's begin. This is lesson 3, kinesiotaping. Kinesiotaping. Alright, actually guys, kinesiotape is a brand. Okay, pag sinabing kinesiotaping, that's actually a brand. Okay, the generic term for kinesiotape is muscle tape, or sports therapy tape. In other countries, they would also use athletic tape. So tatlong generic term, muscle tape, sports therapy tape, or athletic tape. Tatlo po yan, same sa kinesiotaping. Okay? Kasi yung first brand na nag-develop ng tape is kinesiotape. That is why the term that we use is kinesiotaping. Pero actually, mali yun. The generic term, the common term for that is supposed to be muscle tape. Kaso lang, okay, doon naandan ta lang nga, ginatawag ta siya kinesiotaping. So that's why nag-stick around ang K-tape. When actually, it's called muscle tape. M-tape siya dapat, or sports therapy tape, or athletic tape. Okay? Same. You put there in your notebook the basic functions, purpose, or indication of your K-tape. Ano po yung functions, purpose, benefits, or indications for the usage of K-tape? Pag meron kayong patient and you want to rationalize your clinical decision making, ito na po for the usage of our kinesiotape. Alright, number 1, you want to improve muscle function. You want to improve muscle function. You want to facilitate or inhibit the muscle. Okay, improvement of muscle function is one of the usage ng K-tape or muscle tape natin. Okay, you have a weak muscle, you want to facilitate the muscle, you want to stimulate the muscle, sige, gumamit ka ng kinesiotape. Number 2, edema control. For control of your edema. Nasulat sa notes? Have you written it down? Okay, control or manage edema. Later on, I will tell you what is the physiology on how the kinesiotape controls or manages your edema. Yung type of edema dito is the chronic swelling. Okay, yung chronic na swelling. Number 2, we have pain management modality. It is used for reduction of pain. It is used as a pain management modality. Okay, pang reduction siya ng pain. Number 4, we have joint function assistance. Joint function assistance. So indirectly, because we improve the muscle, ma-improve mo rin yung joint natin. Okay, so those are the 4 basic functions or indications or purpose and benefit of our kinesiotape. Muscle function, improvement of muscle function, control your edema, manage edema, yung chronic swelling, reduction of pain kasi it's also a pain management modality, and number 4, joint function assistance. Okay? Sige. So if you will ask bakit gumagamit ka ng kinesiotape or ng muscle tape, sabihin mo yung 4. Okay? You can use those 4 as your rationalization so that you can apply your kinesiotape. Alright? Sige. Next tayo, important things to note for application. Important things to note for application. Okay, number 1, the edges. Ito mga necessary things that you need to know during application. Okay, application parameters kumbaga. Number 1, the edges of the kinesiotape should be rounded or beveled. Ita-type ko kung ano yung meaning, beveled. Bevel. Okay. Rounded or bevel. Ayun, if you can see in the chat, it's bevel. Okay, it's bevel or rounding. Ito, if you can see in the kinesiotape, it's square. It's a sharp edge. Pag ganun, it can easily tear off the skin. Okay, it can easily be removed from the skin. So to help our kinesiotape stick well, to reduce the risk of tearing, what do? We round the edges. We round the edges. Ito siya, I've rounded it already. Naka-rounded na siya. Okay, we smoothen or we beveled the edges. Tama? Okay, number 2. Number 2, the skin should be dry, minimal hair, and oil-free. The skin should be dry, should have minimal hair, and be oil-free. Okay, so how do you overcome this one? You apply alcohol. Sige, ito alcohol. Alcohol na ethyl ha, hindi yung iniinom. Okay, ethyl alcohol or isopropyl, pwede lang. Okay, you wait for the alcohol to dry or you can wipe using wipe using toilet paper. Okay, toilet paper so that the skin will be dry, will be minimal hair, and okay, oil-free. Oil-free. Nakopy? Very good. Number 3. Your tape, once it sticks with the skin, you rub it. You rub because the friction, okay, what will the friction do? It will provide heat. Kasi yung adhesion ng kinesiotape mo is considered heat-activated adhesion. Heat-activated adhesion. Nung umiinit siya, it becomes more, okay, it has more adhesive powers to the skin. It will adhere more, mas matapik pagid siya if i-friction mo. Okay? The tape has heat-activated adhesions. Heat-activated adhesion. So hindi siya dasig makakas kay heat-activate. Kay grabe ang iya adhesion. You can activate that powerful adhesion using heat or friction rub. Okay, meron pa po. Number 4, in the application of your palm and sole of the foot, palm of the hand or sole of the foot, you anchor on the dorsum. You anchor on the dorsum. Kung kilanlan mo gid, magtapik dire no. Okay, if you want to stick here in the palm of the hand or in the sole of the foot, maglagay ka ng anchor or terminal end of that tape dito sa dorsum part. Okay, bakit sir? These areas, the palm of the hand and the sole of the foot, they perspire a lot. Nagabalhas na. They sweat. They perspire a lot. So the tape, it will not stick well. Kaya kailangan you anchor at the dorsal area. Okay, you listen carefully to the lecture so that you can apply your kinesio tape pagdating ng intramurals next year. Char, hopefully next year, balik na tayo sa normal. Okay, sige, number 2. Number 5 na pala tayo. Number 5. Okay, the first 2 hours of application is the most optimal. The first 2 hours of our application is the most optimal. Anong optimal? Optimal adhesive strength. Nasaan po yung pag-stick ng tape on the skin very strongly? Okay, the adhesive strength is optimal in the first 2 hours. So if you have an athlete, you have a client, no? Yung client mo, athlete siya. Okay, may game siya. The client has a basketball tournament. 2:00 ng hapon, 2:00 p.m. When will you apply the kinesio tape? When will you apply the kinesio tape? You will apply it in the at what time? Can you comment? Can you comment anong oras si patient kailangan magpa-taping if 2:00 ng hapon yung tournament niya? If the tournament is at 2:00 p.m., when will you place the kinesio tape? 1:30. Gaan siya na. Okay, minus 2 hours. Because, di ba nabal ko, the first 2 hours of the application is the optimal adhesive strength. So, dapat mga 12. Okay, mga 12. 12 noon. Yes, 12 noon. Correct. Okay, 12 noon. Because, after the first 2 hours, dira siya most optimal adhesive strength. Okay, matapik gid siya tudo. Because if recent siya, basi magbalhas si patient, kung magbalhas siya, dasig siya mahukas. Okay? Pero kung 2 hours before, nakatapik na gid siya strongly. Alright? So dapat, the first 2 hours, so dapat before 2 hours, naka-apply ka na mayo. Alright? Again, because, yes, after 2 hours pa. Not within, sorry. Sorry ha, let me clarify. After the first 2 hours of application, dira ang optimal adhesive strength. Kaya kung before 2 hours, hapos siya kakson because basi mabalhas ang skin. Okay, so hindi siya 1:30 kay basi mabalhas ang skin. Okay? So kung nakatapik na siya daan, then mabalhas ka or mabasa siya, hindi na siya makakas. Okay, thank you very much. So dapat, siya, for after the first 2 hours. Dara na siya matapik good strongly. Okay, very good. Number 8. Number 8 na ba? 3, 7. Oh, number 8, I think. Okay, sige. In the roll, ay, nasaan na yung titik? The roll, this one, this is 10% stretch already. The roll is having 10% stretch already. Ay, sorry, number 6, gali. Okay, number 6. Thank you, guys. Okay, na-lost na ako sa counting, ha. Number 6, the K-tape is already pre-stretched at 10% on the roll. Okay, number 6, the K-tape is pre-stretched on the roll. Meaning, diri pa lang sa roll, naka 10% stretch. Okay, if you want to apply in the patient, you apply 25 to 50% stretch. If you apply to the patient, your K-tape should have 25 to 50% stretch. Okay, number 6 to, the K-tape on the roll is 10% pre-stretch. If you apply to the patient, how much stretch do you want to apply? 25 to 50%. Okay, number 7, Number 7, the end of the anchor, or the anchor rather, or the bases. Okay, the bases are unstretched. Okay, for example, we have here a tape. Meron akong na-cut na tape. Kung saan ka po mag-anchor, where you place it, it should have no stretch. Again, walang stretch at the anchors or at the end or at the bases. Okay? Running through the muscle, may 25 to 50% stretch. But, okay, number 7, you put there in your notes where the bases are, where the anchor is, or where the tape ends. It is unstretched. Wala pong stretch at the bases, at the anchor, or at the ends. Okay, number 8. Sure na ako, number 8 talaga ito. The tape ends, yung terminal portion. Okay? Your anchor should have at least 2 finger breadths. At least 2 finger breadths. Yung width, 2 finger breadths. Ibig sabihin, if this is my tape, 2 finger breadths, yan po, ito po yung anchor ko. Okay? It is usually equivalent, equivalent to at least 3 boxes. 3 small box. Okay, kindly take note, your kinesio tape, this is not your primary treatment. Again, your kinesio tape is not your primary treatment. This is just adjunct therapy. Just part of your treatment, but not the whole treatment. Are we clear? Okay? Hindi pwede nga, nag-treat ka lang, nagbutang ka lang kinesio tape tapos sukton mo ng pasyente. No. This is not your primary treatment. This is just adjunct therapy. Okay, if you want to facilitate your muscle, what is the best treatment? Siyempre, mag-therapeutic exercises ka. Mag-strengthening or resistance exercises ka. Correct? No, you don't use your kinesio tape. You don't use the kinesio tape for the sake of primary treatment. No, you use your therapeutic exercises. Okay, ano pa? Kinesio tape does not need the prescription of the medical doctor. Again, kinesio tape does not need the prescription of the medical doctor. Nasa PT po talaga yung pag-recommend ng kinesio tape. It is up to you and your clinical decision making to apply this or not. Kasi naman, this is not totally for rehab purposes. Again, this is not totally for rehab purposes. Okay, again this is not totally for rehab purposes. Meaning, you can use this on your client kasi yung rehab portion, that's for our patients. Okay, this one is for clients, mga athletes. Pero you can still use for your rehab patients if talaga needed. If needed. But if not, okay, ito, the sole autonomous decision making for the prescription of kinesio tape is up to the physical therapist. Okay, let's go now to the contraindications. Contraindications. Okay? Number 1, contraindicated, open wounds. Open wounds. Hindi po pwede mag-apply ng kinesio tape kung may open wounds. Diba? Okay, number 2, unhealed scars. Unhealed scars. Yung kugan, ang kugan, scar or scab, hindi pwede. Okay, may nag-question, Prof, what if hypertrophic scarring or keloid? Can I apply my kinesio tape? Yes. Yes, you can. Kasi pathological siya but it already closed. Healed na yon. By unhealed scars, what I mean are yung mga scar, scab, kugan. Okay? Meron pa siya clot. May black pa na bala nga clot. Okay, hindi pwede. You cannot put tape over your unhealed scars. Tama? Number 3, acute episodes of skin conditions. Acute episodes of skin conditions. Like where you have dermatitis. dermatitis. Ano pa? Ano na gani ang may sausage fingers? Psoriasis. Okay, psoriasis. Hindi pwede mag-kinesiotape kung may psoriasis ang patient. Ano pa? Allergic reaction. Okay, allergic reaction. Hindi man na siya pwede kung, okay, kung nagbutang ka tape, dahil nag-allergic reaction, you need to remove. Okay. Skin asthma. Okay, skin asthma, hindi rin po pwede. Okay, acute episodes of any skin condition, wag na po mag-kinesiotape or muscle tape. Let's review contraindications. I-check mo sa notes mo, open wounds, unhealed scars, and acute episodes of skin conditions. Okay, very good. Okay, I have a question. Can you comment? Pag si patient, okay, nag-apply ka after 1 day, naglipas na 1 day, nagkatul. It became itchy. Okay, what will you advise your patient? Can you comment there or chat? What if nag-apply ka, kinesiotape, after 1 day, nagkatul? What will you advise your patient? Can I see your comments? Remove. Very good. That is correct, Ma'am Posadas. You remove the kinesiotape. You advise the patient to take it off. Ay, anong take it off, sir? Take it off you peel off the tape. Okay, very good. Remove. Kaksun. Yes. And hindi na magliwat. Ay, grabe. Hindi na magliwat. Actually, yes. Kaksun and hindi na magliwat. No? Kay kasakit. Char lang. Okay, kaksun lang. Okay, thank you very much. Remove it. All right. Hindi lagi ko yung magliwat. Okay. Sige, let's proceed. Meron pong color theory before. Color theory. Where the color dictates the strength of or the function of the tape. But hindi na po yun effective. Okay? It was the wrong model. Hindi na po siya nakaka-explain ng facts. Kaya hindi na po siya accepted yung color theory. Noon kasi pag red, stimulating. Pag blue, it's for relaxation. Ngayon, hindi na po. Okay, walang color theory. There is no such thing as color theory. So if a personal trainer or a fitness coach or a team coach, no, sasabihin niya, you use the red color kasi nag-activate yun. Okay, sabihin mo, sir, excuse me, I'm a physical therapist. We do not have the color theory. Okay, because we have different brands already. Noon, si kinesiotape, pag red, it is really used for stimulation. But then the presentation or the emergence of the different brands in the market of kinesiotape, there is no such thing as color theory. Okay, let's proceed with the techniques for kinesiotape. Techniques for kinesiotape. Question. Ay, pila ka days effective ang kinesiotape? Thank you very much, Miss Precious, for that very good question. Okay, correct din na siya nga question. I forgot to tell you. Okay, how many days effective? You can leave this on the skin for 3 days. You can leave this on the skin for 3 days. If there are any allergic reactions, you remove it immediately. But this one, kahit mabasa, kahit magbalhas si patient, basta optimal ang pagbutang, it can last for 3 days. Okay, it can last for 3 days. Kung dumakakas siya before the 3 days, it's okay, just peel it off. Then the PP can put it again, ang kinesiotape. Okay, but pila ka days effective? 3 araw po. Okay, depending on the brand. Depending on the brand. Kung medyo mahal, like kinesiotape, gidya nga brand, it can last for 7 days. But the average for most brands is 3 araw, 3 days. And for cheaper brands, 1 day. Okay, thank you very much. Sige. Let's go now to the application. Okay, application ng techniques. Techniques. Okay, first, there are tatlong shapes. There are three tapes. Sorry, there are three shapes. The letter Y, the letter I, and the fan. The letter Y, the letter I, and the fan. Okay, the letter I, you use the letter I for muscles that run across parallel to the axis of the long bone. Again, if the muscle runs parallel to the axis of the long bone, you use the I tape. Again, if the muscle runs parallel to the axis of the muscle, you use the letter I tape. Okay, for example, biceps brachii. Biceps brachii, ito siya from origin. Okay, origin niya coracoid process. Coracoid of the shoulder, tama? Going to the radial tuberosity. So it runs parallel to the axis of the humerus, kaya gagamitin ko I tape. I shape na tape. What else? Quadriceps. Quadriceps from your pelvis going to your knee. Okay, quadriceps. You use the letter I technique. What else? Hamstrings. Okay, one portion of the hamstrings. For example, biceps femoris. What else? Extensor carpi radialis brevis or ECRB. Starts from the lateral epicondyle hanggang sa base of the second metacarpal. This is I technique because it runs parallel to the axis of the radius and the ulna. Okay, kasi letter I. What about letter Y? Imagine utod na ko daan. Letter Y. You use the letter Y if the muscle, letter Y, if the muscle is spread in fibers. If the muscle is spread in fibers. May separation siya. Example, you can use the deltoid. Spread siya. May anterior head, middle head, posterior head. Naka-spread siya. So dapat letter Y para naka-cover ka sa whole muscle belly. Okay? The whole muscle fibers, ma-cover mo. What about gastrocnemius? Is it letter Y or letter I? Yung gastroc po is letter Y kasi it has a lateral head and a medial head. Pectoralis major, letter Y. Kasi meron siyang clavicular fibers, sternal fibers, and the rib fibers. No, tatlo siya. Clavicular, sternal, and rib, costal. And then ma-insert siya sa lateral lip, no, of the humerus. So spread siya, you use the letter Y. Okay, doon muna din siya. Oh. Doon muna din siya, ang pectoralis major. So it depends on you. You know your anatomy, you know your origin insertion, so you should know it's up to your decision kung ano yung gagamitin mo, letter Y, letter I. Lastly, we have the fan tape. Fan. Okay. They don't know if nakita nyo kagina, may ari ko din. I don't know if you've seen it. Okay. Fan type. Pag ito, I will cut further into 2. I will divide this further para maging 4. Fan type. You use that for edema. You use that for edema control. Alright. Sige. Ano pa? Let's have the attachment technique. Okay. If you want to facilitate the muscle, you insert origin to insertion. Origin to insertion. You want to facilitate the muscle, origin to insertion. Okay, if I want to facilitate my ECRB, so dapat lateral epicondyle papuntang base of the second metacarpal. Tama? If I want to facilitate my deltoids, if I want to facilitate my deltoid, magsisimula ako dito sa clavicle and the acromion going to the deltoid tuberosity. Dapat, kung facilitatory, it's origin to insertion. Alright? What about relaxation? What about inhibition? What if I want to inhibit the muscle? What will I use? You will attach the kinesiotape from insertion to origin. You will attach the kinesiotape from insertion to origin. Okay, for example guys, I have example lateral epicondylitis. Lateral epicondylitis. Lateral epicondylitis is a condition that is caused by overwork or overfatigue. Nasobrahan sa activation yung isang muscle. Kung lateral epicondylitis, that is ECRB or extensor carpi radialis brevis. Okay, so if you have your ECRB, overwork, overactive, nasobrahan na sa paggamit, you want to inhibit it to reduce the pain of the patient, what will you do? You will insert the kinesiotape from insertion going to origin. Tama? Inhibitory, relaxation, insertion to origin. Okay, mag-a-apply ako. So please remember beveled edges or rounded edges. 2 finger breadths yung attachment. So magpo-fold ako dito and I will cut it. Okay, after cutting it, it's time to apply my anchor. Mag-a-apply ako dito sa base of the second metacarpal. Please remember again that the skin should be dry, minimal hair. Buti na lang minimal hair naman ako. Minimal hair and oil-free. Okay, so ito na, mag-a-apply ako. Low band-aid lang na siya magtapik. Ayun, okay. And then I will, heat-activated adhesion. Heat-activated adhesion. If you want to practice, you can buy from Shopee. Meron, baratuhon. Baratuhon lang na ibaklod nyo, at least makapractice ka mo, no? Okay, in Manila, what they do, the PTs there, they charge per big box. Ito, per big box. Kita mo na yung box na sa tunga. We have a red boundary here sa babaw sa dalong. They charge per box. Some therapists would charge 300 pesos per box. 300 pesos per box. At kapag hamstring, okay, in some athletes sa Manila, dahil malaki sila, they would have 12 boxes sa application ng kinesiotape. O, pag 300 pesos per box at saka 12 boxes all in all, can you tell me how much does the player have to pay? Sige be, comment niyo kung tagpila-balayran ni player. $12 boxes, tapos tag 300 each. Oh my God, 3,600. Oh. So, depende sa inyo kung how you charge, kung per box or dala na siya sa treatment package. Okay, ako yung dala na sa treatment package ko, no? Okay, sige, next. Tapos sa tadi, ma-apply ta. Okay, we will apply. Ano nga, how many percent stretch? Can you help me? How many percent stretch yung kailangan ko? It's 50% stretch until I reach my origin. Ayun, nagsistretch ako. Okay, I will put stretch there. Okay, until I reach my lateral epicondyle area. Tapos, hindi na ako mag-stretch pagdating sa lateral epicondyle. All I have to do left is to perform the friction. Okay, I will do the rubbing. Okay, for the rubbing, you can use this or you can use your fingers. It's okay. Okay, because it activates the heat-activated adhesion para magtapik din siya. Ayun. So now I have my kinesiotaping for lateral epicondylitis. Okay, correct? Insertion to origin so that I will inhibit my ECRB or extensor carpi radialis brevis. Tama? Okay, sige, aray na siya. Okay, how does it resolve pain? How does this one resolve pain? Isulat sa notes, guys, I will teach you. It has tactile perception. It has tactile sensation. Because it touches your skin, no? Because it touches your skin, it uses the gate control theory. It uses the gate control theory. Since it touches your skin, it activates the beta receptors for your skin sensation. Kasi pag pain, especially chronic pain, it's C, okay, C or the slow fibers. So ito, it activates the beta, so faster siya. It can give you relief when it comes to chronic pain. Tama? Okay, guys, last na lang talaga. Okay, we have last two application, last two technique. All right, one more thing. We also have our fascia technique, our fascial technique. Ita-type ko ha, fascial technique. All right, if you see there, fascial technique, it's also used for pain management. Yung ginagawa, where the area of the pain is, ililift mo yung skin, and you will apply a tape that is perpendicular to the line of application. Again, the fascial technique, where the pain is, kung nasaan yung pain, for example, I have my pain here, ililift ko yung skin dito to deload the muscle, and I will apply a tape that is perpendicular to the axis or to the application, to the line of application. Okay, again, the fascial technique, kung nasaan yung pain, example, nandito na yung pain, I will lift the skin there, and I will apply a tape while the skin is lifted. I will apply a tape that is perpendicular to the line of application. That's the fascial technique. All right, last one, guys. We'll have now the application of your edema control. So fan type. So pag fan, I will cut this into halves further. Okay, I will cut it into 4 strips lahat para maging fan type siya. Okay, the same pa rin, you apply it na may beveled or rounded edges. Guys, last na lang gid, promise. We're almost done. Okay, arin na siya. Ginagunti ko na lang siya, guys, ha. Wait sa. Sandali lang po. Ito na. Alright. It looks like this. Fan type. It has fingers. Fan type. Okay, the edges should be rounded. Naka-round na siya. So, i-round ko pa gini further. Ayun. So, dapat naka-round na siya. Okay? Sige, assuming na round na tanan. Okay, how does this tape control edema? Okay. Later on, if I will apply, there will be kunot-kunot. Okay, there will be areas na naka-amuni ang tape. Okay? There will be areas there. The tape will, okay, you listen carefully, you copy. The tape will lift the skin and the layers under it. Okay, it will cause increase in interstitial space so that it can drain the fluid towards your anchor. Again, it will lift the skin up and the layers under it. Pag nag-lift ng skin up, it will pull the fluid towards your anchor area. We will remove the interstitial space. Okay. Sige. Ang rule sa positioning is if ano ang optimal activity. Okay, for example, kung basketball, ang optimal dapat naka-overhead, kay ma-throw. So dapat dira ka man ma-apply sa kinesio tape sa naka-overhead activity. Alright, kung ano ang activity ni patient na diin niya kilanlan help, dira ka ma-position na magbutang sa kinesio tape. Alright? For example, what if si patient na sakit ang iya tuhod, sakit iya quadriceps kung mag-squat? Meaning, dapat ang pagbutang sa kinesyotape, naka-partial squat man si patient. Okay? Or you want to inhibit your hamstrings. Ano, you want to inhibit your hamstrings. Di ba mag-inhibit, dapat naka-prolonged stretch. Okay, so meaning stretched position ang pag-apply sa kinesyotape sa hamstrings. It depends on the activity of the patient. Alright? Yes? Did I answer your question, Ms. Key? Yes. Okay, it depends on the position. Okay, kung ang activity requires overhead, meaning you apply the kinesyotape overhead man. That's why wala na siya general application. It depends on the patient. Thank you very much for the question, ma'am. Okay, so again, how does your kinesyotape reduce edema or manage edema? It lifts the skin up kasi adhesion ito. Magtapik siya sa skin, it will lift the skin up, okay, and the layers under it, and it will pull the fluid towards the direction of the anchor. Towards the direction of the anchor. The anchor is placed in the area of the lymph node. Again, the anchor is placed in the area of the lymph node. So kailangan alam mo muna kung nasaan yung lymph node. Okay, I will show you an example. For example, meron akong patient, her condition was elbow fracture. Okay, na-fracture yung elbow niya, yung distal humerus niya. Nag-bite siya, na-follow na outstretched hand. So, ang yung gagawin ko, naghabok ang iyang elbow, nag-swelling, chronic, 1 month na. I will use my kinesiotaping technique. Okay? How do we do that? Ito po, yung kinesiotape, you will anchor on the lymph node. Okay, may mga lymph node tayo dito. You will anchor there on the lymph node. Okay, dahil it anchor ito, you do not apply stretch. Because this is anchor, you do not apply stretch. Okay, so I will put my ano ganun itawag? Heat activated adhesion. Tapos isa-isahon ko na siya tapik. Okay, isa-isahon ko na siya tapik ha. Okay, ari yung first finger. Okay, you still apply the stretch na hambal ko. Okay, the first finger, ito na siya. Next, the second finger, we will apply. The second finger. Okay. Next. Dauphin type lang siya, Dauphin. If you can search in Google, mayara, pag na sila mga crisscross, crisscross ang ilang fingers, that's okay. You can always learn how to do that. Mayara man ni creativity sa pag-apply, guys, ha? Okay. Please remember to bevel the edges. Last one. Okay, we put here. Okay. Ala siya. If you notice, I will bend my elbow. Okay, makita nyo yung gakunot-kunot. Ari siya, gakunot-kunot. Okay, that's the one I've been telling you. It will cause micro decompression. Again, kung di gakunot-kunot, if you can see, hopefully you can see araonan. Gakunot-kunot, this one, if you can see in your screen, gakunot-kunot. Okay, that causes micro decompression. It lifts the skin up and the layers under it, and it will pull, okay, kung may swelling ko di, it will pull all the swelling towards my anchor, and my anchor is in my lymph node. So meaning, ma-drain niya ang fluid in your interstitial space. May stretch gyapon, ma'am. Okay, Ma'am Lisagis, you still apply stretch the 25 to 50%. Okay, may ara gina siya gyapon. Kung may tattoo, okay, kung may tattoo, you can still apply. Okay, kung may mayroon ko patient na may tattoo siya, gin-applyan siya gyapon namon. Okay? Sa likod, I think in the erector spinae, yes, gin-applyan siya gyapon namon. We just advise the patient if ever magkatul, it causes a reaction, i-remove lang. But so far, okay lang. Wala man siya kaso. The important thing is the skin is dry, minimal hair, and oil-free. Okay? Okay, thank you very much. Okay, any other questions? Wala na? Okay, guys, for prelim, thank you very much. You may close your notes. We are done.
Thank you, sir.
Okay.